Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Welcome to the POMA Does podcast series, sponsored by the Pennsylvania Osteopathic Medical Association. I'm Dr. Elizabeth Zona, an osteopathic physician, board certified in anesthesiology and addiction medicine. My work focuses on substance use prevention and treatment, and through that, I've had the opportunity to care for medical professionals struggling with addiction. While this is my first time moderating a conversation in this space, it's a topic that I feel strongly about. Today will be the first in a two-part series, exploring addiction and recovery in the medical fields. Substance use disorder can affect anyone, including highly trained professionals, yet fear and stigma often prevent them from seeking help. Our goal with this series is to break the silence and to shed light on the realities of addiction in healthcare while highlighting the pathways to recovery and support. For part one, I'm honored to be joined by Dr. Richard Morgan, a physician who has firsthand experience navigating addiction and recovery in medicine. He will share his personal journey, the obstacles he faced, and how he found support and healing. And then in part two, we'll hear from Rochelle Lehman, a pharmacist in recovery, who will share her unique perspective on substance use in the pharmacy profession. Dr. Morgan, thank you for being here. Let's start by having you introduce yourself. I understand you're a physician, you're a DO, you were trained in PM&R, and you are a clinical instructor at the New York Institute of Technology College of Osteopathic Medicine. Can you tell us a little more about your background and what led to your career in medicine?
Yes, thank you, Dr. Zona. I appreciate the introduction, and thank you to POMA for having me. Yeah, I grew up in Long Island, went to, like you said, NYTCom. Back then it was NICOM at the time. And growing up in a very average middle-class neighborhood, never got into any trouble, just an average kid going to school, working hard, wanted to be a doctor my whole life. Ended up going to the medical school about 45 minutes from my house with the total support and love of my family and friends. And everything was just going along, studied hard, got good grades, worked really hard to try to become the best doctor I could be. And what happened was there was this turning point in my life. This wasn't something that I sought after. This was something just happened to me. Early in my third year of clinical rotations, I ended up on my first rotation literally developing horrible tooth pain. And as it turned out, my wisdom teeth were becoming impacted and they needed to come out. So during my first rotation, I elected to have all 4 wisdom teeth extracted. Originally, I thought I was just going to do a couple. So the first 3 went out without a hitch. The fourth one, unfortunately, though, I developed horrible pain followed by fever, abscess, developed a horrible lockjaw. I ended up having to go on antibiotics. I had to get this abscess drained in my mouth. It was the worst pain I ever had. And the doctor had to put me on something called Vicodin. At that time, I really didn't know much about it. And ironically enough, to make this clear so people can understand where I'm coming from, I did not swallow pills. I had never taken a pill in my life. The one time I took a pill was when I was 3 years old and I had otitis media, an ear infection. And my mom actually tried to give me an antibiotic and stick it in a peanut butter and jelly sandwich. Took it. She tricked me by not telling me. I gagged, spit it out. And ever since then, I had a gag reflex. I refused to take pills. So for me to take a pill for any pain was a big deal. That's why, as ironic as that was, I take this Vicodin back in 1997, and almost 10 years to the day, I was arrested by the feds on a conspiracy to distribute OxyContin charge that led to a 14-year sentence. And obviously a lot has transpired over that time, but you can see how insidious and progressive this is. And of course, I'll talk a little bit more about where that came from, where that addiction, I told you about the nidus, the trigger, but how that develops over time. It was really unexplained and really scary at the beginning. So what happened was I started to take those pills. And at first they were just helping with the pain. But then I talk about this gray area where you start to take pills and it's no longer treating the pain, but starts to like morph into this euphoria, this feeling of invincibility, this amazing amount of confidence that I started to have in myself. And it just made me feel empowered. It's hard to even explain, but I just had a euphoria and a confidence that I did not experience before. I enjoyed the feeling. And it was only after I started to take those pills where it literally stopped treating the pain. I guess I was home just taking those pills and just trying to finish the bottle. I was living at home, like I said, and it was just like I said, I remembered that feeling in And once I started to feel that, it was something that I felt like even subconsciously I wanted to chase. And it started off really simple. It was just about me going to get a refill on a prescription. And back then, Vicodin and medications, opiates like that were Schedule 3 drugs, which means you can get refills. And the dentists, the oral surgeons were giving me 3 or 4 refills or more. I mean, it was never an issue. They, whether or not right or wrong, they gave them out in large quantities, and I had enough to just take here and there. And that started to just morph and evolve and start to be like, well, let me just make sure I have them for safekeeping for a particular event or this and that. So I started to, in my mind, Dr. Zona, rationalize, minimize, and justify my drug use. I started to tell myself it was okay to have these pills. It was okay to say, you know what? I need it for this event. I'm going out to dinner with family and friends. I need to build up confidence. I had plenty of confidence. I grew up a middle child. I never had any issues in social situations, but I literally started to use these pills as justification of why I needed to use them. I knew, especially in reflection back on all my past uses and consequences of my actions, I realized how many excuses I was making to myself. And it really boggled my mind as how slowly, insidiously, and progressively this disease started to progress. And it really was scary.
Prescribers ever warn you that this could be an addictive substance?
No, it was not even mentioned, Dr. Zona. No one ever mentioned to me that addiction was an issue. This is in the late 90s, and Purdue had just released OxyContin, and I hadn't even heard of it. It wasn't even in the forefront of my mind yet, but this was just, your basic Tylenol number 3 or Vicodin or one of those medications, but no one ever mentioned to me, doctor, a dentist, oral surgeon, no one mentioned to me the triggers or the possibility of how this could lead to an addictive lifestyle.
When do you feel like it became bigger than you or something that was out of your control? And how did you realize that?
I remember it became bigger than me right around when I started changing and increasing my dose and realizing that there was a point where I was no longer chasing the euphoria, but I was doing the pills to prevent the withdrawal, the dope sick. I was something that I'll never forget. The first time I got dope sick, and I know dates obviously of my incarceration and things like that, but the first time I took a pill that was Oxy, I don't remember the time, but I remember the feeling. It was the most incredible feeling in the world. But soon after that, once you start to chase that, you're no longer chasing the high. You're actually trying to prevent the dope sickness. And those of you listening to this podcast, I would never wish dope sickness on my worst enemy. It's the single worst thing I think I've ever been through in my life. I've done it many times. You literally feel like the world is ending. Crawl up in a ball after 12 hours of not having a pill or any access to any opiates, and after have taken it for months and months at a time. I mean, the headaches, the sweaty, the diaphoresis, which is heavy sweating, high fevers, abdominal pain, nausea, vomiting, diarrhea, migraine. I mean, literally every single possible knife being stuck in my body at 100 at once in every aspect of my nervous system and my muscles. That's really the best way I can describe it. And it doesn't go away. It'll stay there for 10, 12, 14 hours. But I was a good manipulator, Dr. Zona. My wife would be like at the time, "Are you okay?" And I'd be like, "Yeah, I just got a flu. I got a fever." I was able to do the medical jargon thing. And I was very good at convincing people that it was always something else. It was never me. So that's kind of how I was able to kind of morph that and really allow my addiction to propagate because of my great excuses that I developed. And I had tons of them. I was able to really kind of hone in on that. And my biggest fear, Dr. Zona, was being caught or not having that option. See, for me, it wasn't even about taking the pill. I would say the comfort of having those pills in my pocket was just as important as having the pill and knowing that, God forbid, I start to get that headache, that fever, whatever it was, I had that one extra pill, that comfort. It was such a comfort to me to know I had it that I would actually try to stretch out not taking it because the fear of having nothing was much worse than the fear of only having one. And it's amazing.
Described as the pursuit of pleasure morphing into the avoidance of pain. Would you agree with that?
Absolutely. The morphing from pleasure into pain. And it's such a fine line, because I can tell you many times where I learned the right way to try to get the maximization of getting the best euphoria possible. And it didn't work all the time. The things that I did to maximize my euphoria would be empty stomach, hot cup of black coffee, popping 10 to 15 oxys at once. If I can do that, I knew that it it was going to be absorbed directly into my bloodstream. It would not go through the GI system with any food or anything. And I wanted to maximize the high. And that's exactly how I took them. I literally took them on an empty stomach with a black cup of very hot coffee. And that's how I was able to maintain that. But it didn't last all the time. Sometimes I got a bad batch, I used to call it in my mind. It was just random generic version. So I couldn't always afford the trade name from the main company. And they were a lot cheaper. They didn't work as well, to be honest. And I could take 10 of one brand and 10 of another. I can almost look at the color and the shape and know if they were going to work. And a lot of times they didn't always reach that. And that's when I was worried about the withdrawals coming on sooner. And like I said, you're right. There's a very fine line between the pleasure and the pain involved.
Still in your medical training at this point, right? Your addiction developed between medical school and residency, if I recall. Does that timeline sound right?
That is correct. The first pill I took was third year medical school, but it was in my residency where I started to really, start to fly through prescriptions. And in fact, I started to develop a system where I went to NYU for RUSC, for rehabilitation medicine, and working in the hospitals. For me, it was about, I could go down to the pharmacy, get the discharged patient's prescriptions. I could literally write my own prescription for, Tylenol number 3 or Vicodin and then fill it for the patient. And that bottle would never make it upstairs. Like, it was that easy for me to basically give myself an extra 30 or 60 pills that I would have. And like I said, that comfort of having that helped me. And I got away with that for a couple of years. I mean, there was just no system of checks and balances in place in the hospital systems and the pharmacies, for that matter, in the New York region. iStop only happened while I was away. Things were much different, Dr. Zona. It's not the way it used to be. So I love sharing the story because you could not do what I did then now. There is no way, but I still think it's an important lesson to learn because there's always going to be someone willing to try. And I still see stories of every day of doctors getting caught for A, B, and C. And I'm like, how is this still going on? It blows my mind. So yeah, it's a scary proposition to think of how easy it was for me in the early 2000s to do what I did. And if the systems were set up, Dr. Zona, like they should have been, I never would have been able to get away with it. I would have been scared out of ever attempting. I would have been shut down right away. And I wouldn't have had to chase these highs, chase these things, run away from the dope sickness. Again, I'm not rationalizing or minimizing. It was the sign of the times. It was such a new venture. The opiate crisis hadn't begun yet. It was just taking off. And it was just the way that the companies were manipulating the public and their own pharmacists to promote these medications for not off-label uses was what really allowed dentists, oral surgeons, and people like me who are in vulnerable situations for them to say, I could have just taken Tylenol or Advil, but they're giving me Vicodin. Like, why? So it's quite a journey. And again, every journey has a reason and everything happens for a reason. Whatever happened in the past, I'm here to say that I've been able to overcome a lot of the things that I've been through. And that to me is all that matters at this point.
Training, nobody happened to notice that you were struggling with an addiction.
It's funny. No one noticed the struggles in my job. They might have thought something here and there where I looked a little tired, a little off kilter once in a while. But it was really my sister who started to notice more things than any. My sister's a pharmacist and she spent 10 years working for Pfizer. And we used to have lunch in the city because I was at NYU and she's in Midtown at Worldwide headquarters there. So I would meet with her for lunch and she would literally see me, and she actually called me out once. Is like, are you okay? And I was like, I cursed her out once. I called her a very bad word. And I was like, how dare you call me that? And at the time I was totally stone high. I was literally high on Oxy because again, I used that same excuse that, well, I needed it to be around my sister because it made me feel good and I got more hyper and I got more active. It made me feel really confident. But again, these are just excuses I made to use the meds. I had a number of fender benders because I didn't drink. I basically took pills because I knew that you can't breathalyze someone for pills. It doesn't work like that. So she's the one who actually not only called me out on my S, no pun intended, but she actually is the one who, after I got into one of my fender benders, found the pills scattered all over my car. And that led to my intervention back nearly 9 years after my first pill. So
fortunately, she was educated enough to recognize what those pills were and what that could have represented was going on in her brother's life. Blessing in disguise, it sounds like that accident. So can you just briefly go over what sort of happened as far as you finding recovery, if you were hesitant at first or willing at first, kind of how long that whole thing took? What I understand turned into some legal problems for you.
Yeah, I mean, as far as recovery, I had an intervention on the summer of 2006. My dad, my stepmom, my wife at the time and my father-in-law, and they basically, came together. You got a problem. You're not well. And they literally handed me a plane ticket and said, get on a plane, you're going to Florida. So I had no problem accepting it. I knew I was sick. I didn't know how to ask for help. And part of me wanted it, but part of me was afraid to lose the ability to have that comfort. So it was a challenge for me because even though I admitted to saying I was ready, I really wasn't ready. And I can prove it by saying, well, I went right down to Florida and I ended up screwing up within my first 2 weeks there. I literally called one of my patients who I was selling pills to, and I had them mail me down pills in a bottle. And obviously I got caught. They ended up kicking me out of that rehab. Then I tried at another rehab to call in a prescription for Vicodin, which is a Vicodin cough syrup, called that in with some Tylenol number 3 at a pharmacy, which was very easy, 3-letter pharmacy, which I won't mention. But they basically went ahead. They sent the medications in. And of course, I popped pills and then we had a party and I got caught again. And eventually I got kicked out of 2 rehabs, ended up going to a one for 90 days. And I did complete that 90-day one. I didn't use again. I said, I'm going to just do my thing. But at the very end, the director of the place met with me and he said, you know what? You might have gotten through it, but you know what? If you don't change your ways, Mr. Morgan, he said, you're going to either end up in a year, either in jail or dead. And his words rang true. And 9 months later, I was arrested. So it just goes to show you, these people who teach recovery really know these things. And I wish I had listened to my sister way back when and listened to my family and kind of got my stuff together earlier. So yeah, it was a real challenge as far as realizing that.
It's a really good point that someone who had been a professional in that space was able to predict what was going to happen in a year. And it's interesting because I feel like we do try to warn people sometimes, and maybe it's a good take-home point for listeners today that, when you are caught up in your own addiction and you're listening to that sort of prioritization to that substance, that it's really hard to listen to the people that can look at it from an outsider and say, this is the path you're on and this is where that goes. And you just have such a drive because of the neurobiology of addiction, right? Because of the hijacking of that part of your brain that really prioritizes things and thinks that this is needed for your survival. It can be quite hard-headed in active addiction, right?
You're absolutely right. And the thing is, we can all talk about neurobiology of addiction medicine and we could sit here talk for hours and hours about it. But if the person doesn't know you as intuitively as they've grown up and know your life experiences and know who you are and see how the drugs change your personality, change your behavior, change your character, change all the little things. Of course, the subtle nuances of sweating and things that you see with the pupils. But because it was my sister and it was someone who knew me intimately and knew that there was something wrong with me, all of her training in addiction medicine wouldn't have been able to help her unless she knew it. So I really believe it's a multifactorial thing, Dr. Zona, where it's knowing the biology, knowing the addiction, how it affects the body, but also knowing the person. And that's why it's so important to always be cognizant of our loved ones and who they are and how they change subtly. The platform I stand on is how to recognize addiction in medical students and healthcare professionals. And I try to teach students every day, every week on how to recognize it, that you should always be cognizant of who your friends are. And if you notice something, say something. It's so important because we can only do so much as healthcare professionals, but we have to entrust in you that your knowledge, your life experiences and what you see in your loved ones, your friends, and you see those subtle changes. Don't be afraid to speak up. And to me, that's the most important message that I can share. I'm often asked when I do this, like, what's the most important message I have? And for me, Dr. Zona, it's very easy. It's never be afraid to ask for help. For many years, I was afraid to ask for help. And today I'm the first one jumping out on the phone and I love it. It's just so important. It's empowering. It's humble. It's open-mindedness. It's honesty. And all those things are the reason why that after getting sentenced to 14 years in federal prison, that I have a job as a clinical instructor and medical professor at my medical school because of my honesty. It's the only reason I'm even here today, even on this podcast, being able to share my story with both of you. It's really remarkable. And it's something that is never lost on me. And every day I wake up, life is a blessing. And that's how I view life. And I just look at medicine. I look at teaching from a much different perspective than any other faculty member at the school because they feel that passion. They feel that energy. They feel my vibrancy and they can see that there's something different about me. And that's before they even know my story. But when you get to know me and you peel the layers off, that's the best part of it. When I see the students' expressions when they're like, holy crap, he was in prison. It's hysterical. So I love it.
It's amazing. What a comeback. Can you talk briefly in the couple minutes that we have left of your story sort of about reintegrating into medical world and education and, just after you had been in the system and after you had been dealing with your incarceration and how you sort of came back and what stigma you've faced, and maybe just a quick blurb on the PHP, kind of what doctors can do if there is a problem.
Sure. I came home. I thought I was done with medicine, but I still basically spend my time in prison teaching nutrition, men's health courses, trying to give some knowledge for what I've learned so that my time wasn't fully wasted. I came home, got a job at a restaurant as a waiter for 3 years at a restaurant. And then one day, one of my colleagues who was a professor at our medical school mentioned that I should come and share my story with the students at something called CPR, which is Clinical Practice Reflections. I said, you know what? This is a great opportunity to share my story. And this is what I talked to you earlier about honesty. I went, shared my story for 2 hours, not a dry eye in the house. 600 students and 30 faculty stood up and applauded me after. And afterwards, students were coming up to me crying, shaking my hand. One girl came up and took a pill bottle and said that she threw it out after she heard my story. To me, that there's no better feeling than that, to be able to express the ability of open-mindedness and honesty to these students to make a difference. And not long after that, they basically said, you have a way with these students and we'd love to hire you. And that's how I got my current job. Regarding stigmas, this is the amazing thing, Dr. Zona. My only stigmas originally were placed on me, my own limitations. Students and society today, I feel, from being in school, from the first time I shared my story when I was really timid and scared, they're very non-judgmental and very accepting. And it's really amazing to me. It's almost like life stops, life is boring, but now we have this guy who's been to prison. He comes home, he's been a waiter, he's done this and that. Like, wow, what was this like? What was that like? So there were not many stigmas. The stigmas for me are on the process of getting my license back. But again, there are many avenues that have opened up for me. So about 5 years ago, I did sign up with CPH in New York State. Every state has one. It's a physician advocacy group. And in New York State, it's called Committee for Physicians' Health. They're based in Albany. And what you do is you sign essentially a 5-year contract. You get tox screens monthly. You meet with psychiatry. I do weekly groups, monthly groups, all these sorts of things. And now I'm actually about 4 months away from completing my 5 years. And what that means is they will write a letter and they will advocate for me when I go to the medical board. Because after 15 years, Dr. Zona, I'm on the path to get my license back. And it's almost unheard of for someone in my situation, just about to retain a lawyer and go through the license restoration process in New York State. When you have your license, I voluntarily surrendered it. By voluntarily surrendering it, I kept my license technically active and able to get restored. If I had surrendered it and it was revoked, then I wouldn't have been able to do what I'm doing now. But I got good advice back then. I voluntarily surrendered it after my indictment, and now I'm on the process for restoration. And it's really a blessing to me to have battled all the way back from this long prison sentence with sleeping on rat-infested floors in a jail cell 72 hours at a time to working in a restaurant. And now here I am, literally almost like 15 years later, on my way to being able to say that I can actually see patients again.
It's really amazing. And I could see where it would be very difficult for people to not only to have the right guidance as to how to protect their license during that time, but also it's so much work. Recovery is so much work. And, I tell my patients whenever they do have a really tumultuous time in their life and yet they remain sober, I remind them, recovery, it's like a class. It's the hardest class you'll ever take. You're learning all the skills you need to stay in that right mindset and to not get complacent and to not have a relapse. And when life gives you these really difficult times, that's like the exam. That's the test. That's you taking the test. And to see you be presented with these tests and pass them with flying colors, we have enough literal tests as medical professionals. And here you have the figurative tests as well, just reintegrating with society and kind of keeping your head up and keeping focused. So really amazing story. And I thank you so much for sharing that with us. Anything else you'd like to say? I understand that the Board of Medicine is separate from PHP and they keep everything private. Is that correct?
Essentially, yeah. Once I go through the process, there's a long process for you collecting character letters and building up the portfolio. They go back through your healthcare history and they put this whole portfolio together. That's why you have to work with a specific lawyer that's involved in license restoration. But like I said, it's about a 1.5-year process. So it varies from person to person. But because I'm a longer period of restoration, it could take a little longer. But like I said, I had nothing but time. I love my job. I'm blessed to be doing what I'm doing. So for me, it's just a bonus. It's just something to add on to the wonderful blessings that have been bestowed upon me to be able to share my story of strength and hope, work with medical students on a daily basis, and really just train and teach the future doctors of America.
Thank you so much. And to those listening, Dr. Morgan's story reminds us that help is available, recovery is possible, and no one should have to struggle alone. If you or someone that you know needs help, confidential support is available. In Pennsylvania, the Physician Health Program provides resources for medical professionals that are struggling with substance use or mental health concerns. You can reach them at 866-747-2255. And nationally, the Federation of State Physician Health Programs offers additional resources at FSPHP.org. In part 2, we'll continue this conversation with Rochelle Lehman, a pharmacist who will share her journey through substance use disorder and recovery. I'd like to thank Dr. Morgan for sharing his journey and all of you for joining us. If you have feedback or other episode ideas, please email POMA@POMA.org. Be sure to subscribe to the POMA Does podcast on your favorite platform. We'll see you next time. Stay healthy.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.